Good morning, everyone. Thank you for joining us today for webinar Wednesdays with SMP. Our October hot topic is open enrollment and fraud. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs, and I'm going to be your host this morning. Presenting for us today is Keith Havens, who is our Tri-State Media Outreach Specialist, and Nathan Coughlin, who is one of our Georgia Community Outreach Specialists. We will be taking questions at the end of the presentation today. There's also going to be a prize drawing at the end for everyone who was registered for this webinar prior to 10:15 this morning, and the winner must be present to win. Before we get started, I do have to let you know that this project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official administration for community living policy. For those of you who are new today and maybe haven't attended one of our Webinar Wednesday presentations, we want to give you some information about who is Senior Medicare Patrol. Well, SMPs are grant-funded projects from the U.S. Department of Health and Human Services, the U.S. Administration for Community Living. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And this year, SMP is celebrating 25 years of the SMP program. Now I'm going to turn things over to Keith, who is going to start today's presentation by talking about some upcoming important dates. Keith?
Okay, thank you, Sunny. Before we get into the types of fraud and scams that can occur during the open enrollment period, let's go ahead and take a look at some important dates. Each year, it's important to review your Medicare health and drug coverage and make changes if your plan no longer meets your needs or to see if you could lower your out-of-pocket cost. The time to do this is during open enrollment. This chart with information taken from the Medicare and You book at medicare.gov shows you some key dates that you need to remember. First, during the month of October, it's a great idea to start comparing your current coverage with other options. You may be able to save money or get extra benefits. You could visit medicare.gov/plan compare for help during this, or you can contact your local SHIP, which we'll give more information later in the presentation. Now, from October the 15th through December the 7th, you can change your Medicare health or drug coverage for the upcoming year 2023. If you decide to, you can join, switch, or leave a Medicare Advantage plan or a Medicare drug plan during this open enrollment period each year. Now, on January the 1st, your new coverage begins if you made a change. If you kept your existing coverage and your plan's cost or benefits changed, those changes also start on this date. And from January the 1st through March 31st, if you are in a Medicare Advantage plan, you can change to a different Medicare Advantage plan, or you can switch to original Medicare once during this time period. Any changes you make will be effective the first of the month after the plan gets your request. Now remember, Medicare Advantage plans change each year, so it's important to make sure your plan is still the right one for you. During open enrollment, you can stay in original Medicare or join a Medicare Advantage plan. If you are already in a Medicare Advantage plan, during open enrollment, you can switch back to original Medicare. Okay, so now we're going to ask you a quick question. And the question is, have you ever received phone calls from companies trying to sell you a Medicare health plan? So what we want to know is, have you received calls? And if you just take the time real quickly just to answer the question.
Okay, the poll has been launched, and we're going to give everyone just a few seconds to get those answers in. Yes or no, have you ever received phone calls from companies trying to sell you a Medicare health plan? Looks like we've got about 80% who have voted, so we'll give it just a few more seconds before we share the results. All right, I'm going to go ahead and close the poll and we'll share the results.
Okay, well, it looks like the majority, a small majority, have not received these calls. 44% of you said that you have received these calls, and then the rest of you, 56%, said you have not.
Okay.
Okay, now during open enrollment, um, now that we have an understanding of the basics for this year's open enrollment period, let's talk a little bit about how unethical individuals may try to defraud beneficiaries during this period. During open enrollment, you may see advertisements on TV or the internet, or even receive phone calls from individuals all trying to get you to switch to a new Medicare plan. And I'm sure you've all seen these advertisements on TV, with various celebrities telling you that, um, to make sure that you receive all the benefits that you're entitled to, and just call this number. And that they'll give you advice on which is the best plan for you. Now, it's important that you do your own research and choose the best plan for your own individual needs. Medicare enrollment can feel complicated and confusing, and unethical salespeople may use that to their advantage to enroll you in a plan that is not right for you. Remember that Medicare plans are not a one-size-fits-all approach, and what may be the best plan for others may not be the best for you. Now let's look at some examples of open enrollment fraud. Every year as open enrollment approaches, we here at SMP see a significant increase in scams targeting Medicare beneficiaries. Now let's talk about some illicit activities by marketers or scammers that you all should be aware of. Like we talked about, you may get phone calls claiming to be from Medicare or the federal government, asking you to verify or update your Medicare number. And remember, Medicare, Social Security, any agency from the federal government is never going to call you and ask for your information. Another potential scam is an agent using misleading or high pressure sales tactics to get you to enroll in their plan. And someone actually may offer you cash or gifts in exchange for switching your plan. And you may get a representative that comes to your door uninvited or call you if you are not already a member of that plan. That is an illegal marketing tactic for them. They are not allowed to contact you if you have no relationship or you have not contacted them first. You may come across someone trying to charge you a fee for enrolling you in a plan. Or you may receive emails or solicitations in the mail from companies offering Medicare plans. All right, so how do you protect yourself from open enrollment fraud? Now, there are several ways that you can protect yourself, and they include, probably the best one is just to hang up the phone. If you receive a phone call from someone claiming to be from Medicare or Social Security, other times these callers will claim to be from something along the lines of senior benefits. Never, never give out your Medicare or your Social Security number to someone who calls you. And along those lines, you do not engage with a door-to-door salesman. This tactic can be particularly prevalent if you live in a seniors-only community. And this, again, is not authorized by Medicare to market to you. Also, be wary of calling phone numbers you may see on advertisements, such as those you see on TV or receive in the mail. Now, while these advertisements themselves are not illegal, the person on the other end of the phone may not have your best interest in mind for what plan is best for you. It is best to get advice from an unbiased source. And remember, I said that um, these marketers are not allowed to contact you if you don't have a prior relationship or if you don't initiate. So when you see an advertisement on TV and you see a famous football player and he tells you to call this number, when you call that number, you are giving them permission to sell you something. So again, you need to get unbiased help from a trusted source when you make your decision on your Medicare. So where can you get unbiased help? Well, there's a couple of ways. First, you can go online to www.medicare.gov. That's the official Medicare website. And they have a Medicare plan finder. And all you have to do is have all your information ready, have the prescription drugs that you currently are taking, and you enter all this information into the plan finder, and then it will give you a list of the different plans that are available to you in your area and how much it will cost you. Now, the other way is that you can contact your state's SHIP program. And what is SHIP? SHIP is Senior Health Insurance Information Program. SHIP is a sister program to us here at SMP. You know, both of our programs are nonprofits. It's funded through, partly through government grants. Now, SHIP programs are designed to provide Medicare counseling to discover which plan best fits your personal needs. These counselors do not work on commission, and they're there to help seniors make informed decisions by providing free and unbiased guidance via telephone or face-to-face interactive sessions. So how can you contact your state's SHIP program? Well, here on the screen that we give the toll-free numbers for the 3 states. And if you looked at Georgia, 866-552-4464, and you have to press option 4. Louisiana is 800-259-5300. And Mississippi is 844-822-4622. Now, just like the SMP program, every state and the U.S. territories of Puerto Rico, Guam, and the U.S. Virgin Islands, they all have a SHIP program. Now, maybe you or someone who lives outside of these 3 states, or you know someone who lives outside of these 3 states. So how are you able to find the SHIP number for them? Well, they have a national website at shiptacenter.org. And you can go on that website and you can find you can click on the Find Local Medicare Help button at the top right corner, and you will get the contact information for that particular state or territory that you're looking. Okay, now that you know about open enrollment fraud, I'm going to turn things over to Nathan, who's going to share the 3 keys to success in preventing fraud, errors, and abuse.
Hello, everyone. My name is Nathan. I am the outreach specialist in Georgia for our SMP program, and I will get into our Protect, Detect, Report presentation that weighs the 3 keys to success in preventing fraud, errors, and abuse. The first key is protect. Protecting your personal information is your best defense against healthcare fraud and abuse. We want you to treat your Medicare and Social Security numbers like your credit cards. Never give these numbers to a stranger. We always say, in the wrong hands, your Medicare number can be just as valuable to a thief as a credit card number. Remember, Medicare themselves won't call you to ask for your Medicare number. Don't carry your Medicare card unless you'll need it for a doctor's appointment. Keep a record of your medical visits, tests, and procedures in a healthcare journal or calendar. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. We encourage you to review your Medicare summary notice, or your also known as MSNs, or your explanation of benefits called EOBs that either come from your insurance company or Medicare directly if you're on the red, white, and blue Medicare. Your Medicare summary notice is mailed to you by Medicare every 3 months. Now, if you do have a Medicare Advantage plan, you'll receive an explanation of benefits instead after you receive healthcare services. Compare your statements to your personal records and look for the following items: charges for something you didn't get, billing for the same services or supplies twice, or services that were not ordered by your doctor. The third and final key is report. If you suspect you have been a target of fraud, report it. This helps you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statements, call your healthcare provider or plan. We do understand mistakes can happen. Not everything is intentional fraud. We do encourage you to call your physician's office first to see if it can be resolved. If you do not get an answer to your satisfaction, please give the SMP hotline number a call, which you see on your screen at 877-272-8720. And maybe even if you're not comfortable calling your provider, you can always utilize our hotline number, the 877-272-8720. As mentioned in the previous slides, and I'm going to hear it a bunch from you today, our hotline number is always there, and you can also visit our website at stopmedicarefraud.org for additional information about our program. As many of y'all on this call probably know, we offer presentations as well in the community. So if you're a part of a senior center, senior group, some type of facility you think we would be beneficial to give a presentation, please call our hotline number to inquire about those opportunities. Additionally, we would like to encourage you to scan the QR code using the camera on your cell phone that you see on the screen that will guide you to our social media platforms, including Facebook, YouTube, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. We just encourage you, if you're not comfortable using the QR code, to follow us on Facebook. Each state has a SMP Facebook page. Louisiana, Mississippi, and Georgia, just simply type in your state's name with Senior Medicare Patrol, and that page will come up. If you're following us on Facebook, you'll be the first to know about our fraud alerts we send out and when there are some rampant scams happening in your state. So you'll be first to be notified. And I will hand it back over to Ms. Sunny.
Great, thank you, Keith and Nathan, for that information. We do want to encourage you to attend our next webinars Wednesdays event. It's going to be scheduled for November 30th at the same time, 10:30 Central. And we're going to be meeting then to discuss foot bath fraud and scams. So you'll learn more about what these scams look like and how you could possibly be affected and your benefits could be affected by foot bath fraud and scams. And that's Wednesday, November 30th at 10:30. All right, so before we open the floor up for questions and close out today's presentation, we are going to go ahead and do our prize drawing. For those of you who registered prior to 10:15 this morning, your names have been entered on the wheel, and we're going to give it a spin. And this month's prize is going to be a $20 Amazon gift card. So if you just give me 1 second, let's see. And you do have to be present to win. All right. Let's see, it looks like Miss Peggy Bowles is our winner for the month of October. So Miss Peggy, I will be reaching out to you later today to get information to you about how you can get your prize, which, like I said, is going to be a $20 Amazon gift card. All right, so let me see if I can get back to the screen that we were sharing. Okay. All right, so before we get started, we are going to open up the floor for question and answers. So anybody who has a question, please go ahead and raise your hand and I'll unmute your line and you can let us know what your question is. I'm sorry, I'm having difficulty with my slideshow, so it's not showing, but you do have a panel that's off to the right-hand side with a little hand, and if you click on that, that'll raise it, and we'll unmute your line and you can ask your question. And if you're not comfortable doing that, if you want to chat a question to us, you can also reach out to us that way if you choose to. All right, well, I'm not seeing any questions or chats coming in. So this will conclude our presentation today on open enrollment fraud and scams. We will be sending an email after the webinar today with a link to a short survey. And we would really appreciate it if you would just take a few moments of your time to complete that survey. It goes straight to the Administration for Community Living and lets them know how we did with today's presentation. And it was also included in the chat before we started today in case you wanted to go ahead and complete it during the presentation. Well, thank you again to Keith and Nathan for presenting for us today. We do appreciate you all joining us, and please take care, and we hope to see you next time for Webinar Wednesdays with SMP.